Hello, my name is Sharon Merritt, and I will be presenting my project entitled Examining Adherence with Medical Regimen in Patients with Heart Failure. Heart failure has increased in both incidence and prevalence over time, and adherence to the medical regimen has shown to improve both patient outcomes and decrease cost. Keeping a patient out of the hospital is the goal for acute care organizations in an effort to avoid reimbursement withholdings for 30-day readmissions from CMS. Nurses are often the healthcare providers that are educating patients across the continuum, and studies have demonstrated that nurses may not be adequately prepared to provide education to patients with heart failure. Understanding why a patient does not adhere to the medical regimen has been explored by various nursing colleagues and the relationship to self-management. Once a patient is diagnosed with heart failure, numerous lifestyle changes are necessary in order to manage the disease process. The purpose of my project was to increase nurses' knowledge of heart failure self-management education principles by utilizing a 20-item questionnaire to identify deficits, followed by an educational intervention and reassessment using the same questionnaire. The target population was the clinical nurses working on 3 Main at Baptist Health Lexington. Census of the literature reveals that living with and managing heart failure is challenging because it's a chronic disease and frequently has a poor prognosis. However, the more compliant a patient is with the medical regimen usually results in fewer exacerbation of symptoms. Patients must perceive that there are more benefits than barriers from this medical regimen as defined by the health belief model. Patients frequently reported that they did not understand the medical regimen, they were not able to incorporate it into their daily routine, and oftentimes patients were not able to associate reasons for worsening symptoms with a cause. They did report that self-care develops over time and that practice is needed. Physicians have a perception that patients do not understand the regimen even with simple explanations, and this was based on the belief that if the patients understood instructions, they would have not been rehospitalized for worsening symptoms. The project implementation included, during the planning phase, discussion occurred with the CNO as well as the director of 3 Main regarding the plan for the project. The CNO preferred that the project be completed on 3 Main because there's a rapid turnover of patients. An average of 8 patients are discharged each day with a diagnosis of heart failure. The CNO also desired that the teach-back be included into the educational interventions. The design phase included, once approval and support was obtained from the CNO and the director, I met with the nurse researcher to discuss the project. I also obtained approval from Nancy Albert, which was the investigator that developed the questionnaire that I used. I also completed and obtained approval for the project through the IRB at Baptist Health Lexington. During the action phase, emails were sent to the clinical nurses on 3 Main as a recruitment tactic. I delivered the questionnaires to the participants and provided a verbal explanation of the project as well as explained implied consent. I placed a locked secured box in the break room on the unit for the participants to return the completed questionnaires. I was the only individual that had access to obtaining the questionnaires from the box, and I collected the questionnaires on a daily basis. A reminder email was sent to the clinical nurses, which included the final collection date of the questionnaires. Then the data were entered into SPSS software by the nurse researchers, and they provided me with a frequency report. At this time, I am actively working with the Director of Nursing on 3 Main to plan educational interventions and to repeat the assessment. An evaluation of the project, the practice change included an improved patient education through the process of assessing the nurse's knowledge and identifying a knowledge deficit and providing an educational intervention with the ultimate goal, hopefully, reducing the hospital readmission rate at Baptist Health Lexington. Strengths of the project included the use of a valid and reliable instrument, both pre and post educational intervention. I did ask the participants to include their mother's date of birth, both pre and post, in order to compare changes over time. The clinical nurses were engaged with the project from the beginning. I also had collaboration among the stakeholders, which include the CNO, the director, and the nurses, and I also was able to relate the role of the clinical nurses as a patient educator, which promoted their buy-in and increased participation. Changes that I would implement if I repeated the project would be allow more time for the project completion, as well as increase more clinical nurses in the project to increase the sample size. And at this time, I'll be able to entertain questions. Thank you.